हेलो गाइस। आज मैं आपके लिए न्यू टॉपिक लेकर आई हूँ। मेरे टॉपिक का नेम है हॉस्पिटल एक्वायर्ड इन्फेक्शन। सबसे पहले डेफिनेशन ऑफ हॉस्पिटल एक्वायर्ड इन्फेक्शन। द टर्म हॉस्पिटल एक्वायर्ड इन्फेक्शन ऑल्सो नोन एज द नोसोकोमियल इन्फेक्शन. It is defined as an infection developing in patient after admission to the hospital, which was neither present nor in the incubation period at the time of hospitalization. Such infection may become evident during their stay in the hospital or sometime after their disease conditions. So next one is the sources of hospital acquired infection. The first one is the exogenous sources and second one is the endogenous sources. In the exogenous sources, hospital infection is mostly exogenous from another patient or member of the staff or from the environment in the hospital. इसमें क्या होता है कि हॉस्पिटल एरिया के अंदर बहुत सारे स्टाफ मेंबर्स और पेशेंट्स होते हैं जो डिफरेंट डिसीज़ कंडीशन से सफ़र कर रहे होते हैं और उनकी इन्फेक्शन दूसरे लोगों को स्प्रेड हो जाती है. एंड नेक्स्ट वन इज़ द इन्वायरमेंटल सोर्सेज. इन द इन्वायरमेंटल सोर्सेज include inanimate objects, air, water, food and hospital equipments like contaminated equipments, materials such as sanitary installation, bedpans, urinals, light, table, blanket, medical equipment, endoscopes, catheter, needles, septulas and other instruments, floor, food and water. And next one is the surface area. Surface contaminated by patient secretions, excretions, blood and body fluid may also act as a source of infection. And the second one is the endogenous sources. Patient's own flora may invade the patient's tissue during some surgical operation. For example, like if any patient having under surgical procedure, like जब सर्जिकल प्रोसीजर होता है तब क्या होता है, पेशेंट का ओन नॉर्मल फ्लोरा होता है वो इन्वेड करता है पेशेंट के टिश्यू के अंदर और उस टिश्यू को डैमेज करना स्टार्ट कर देता है. लाइक उस टिश्यू की इन्फेक्शन इंक्रीज़ हो जाती है. द पेशेंट्स ऑन नॉर्मल फ्लोरा विच आर नॉट पैथोजेनिक अंडर नॉर्मल कंडीशन कॉज इन्फेक्शन और डिसीज़. These types of infection also known as the opportunistic infection और auto infection. इसमें क्या होता है, जो पेशेंट का नॉर्मल फ्लोरा होता है वही रिस्पॉन्सिबल होता है उसकी इन्फेक्शन को स्प्रेड करने के लिए और पेशेंट इन्फेक्टेड हो जाता है इन द हॉस्पिटल सराउंडिंग एरिया ड्यूरिंग देयर ट्रीटमेंट. एंड नेक्स्ट वन इज़ द मोड ऑफ ट्रांसमिशन. अंडर द मोड ऑफ हॉस्पिटल acquired infection transmission, there are the four main route. First is the contact route, second airborne, third one is the oral route and fourth one is the parenteral route. Under the first contact route, there are the main two types of route: hands and clothing and inanimate object. Hands and clothing. Hand and clothing of hospital personnel contain some microorganism received from patients or own body which serve as an important vehicle of transmission of hospital acquired infection. Important pathogens that spread by hand contact include the Staphylococcus aureus, Streptococcus pyogenes and coliforms etc. Under the inanimate object, inanimate objects like equipments, materials, urinals, blankets serve as a reservoir of potentially pathogenic bacteria. And second one is the airborne route. Under the airborne route, first is the droplet infection. Inhalation of droplet from infected person lead to respiratory infection. And the second one is the dust. Dust from floor, bedding, dispersed from wound during dressing and from skin by natural shedding of skin scales spread to the susceptible site of the infection of the body. And the third one is the aerosol. Aerosols means produced by nebulizer, humidifier and air conditioning apparatus transmit certain respiratory tract infection. Like जो एयरबॉर्न इन्फेक्शंस होती हैं वो मोस्ट ऑफ रेस्पिरेटरी ट्रैक इन्फेक्शन ही स्प्रेड करती हैं. एंड द थर्ड वन इज़ द ओरल रूट. फूड prepared in hospital may contain gram-negative bacilli which are most often antibiotic resistant. These bacteria may colonize the recipient's intestine and become established in the fecal flora of these patient. And the fourth one is the parenteral route. Transmission of infection by parenteral route has been limited and is infrequent due to introduction of single-use disposable syringe and needle. However, certain infections like hepatitis B and HIV may be transmitted by blood transfusion. एंड द नेक्स्ट वन इज़ द some common hospital acquired infection. इसके अंदर आता है फर्स्ट इज़ द यूरिनरी ट्रैक इन्फेक्शन. दिस इज़ द मोस्ट कॉमन नोजोकोमियल इन्फेक्शन. 80% ऑफ इन्फेक्शन आर एसोसिएटेड विद कैथेटराइजेशन और इंस्ट्रूमेंटेशन ऑफ यूरिथ्रा, ब्लैडर और किडनी. Urinary infection are associated with less morbidity than other nosocomial infection. And the next one is the respiratory infection. Nosocomial respiratory infection is the second most common type of hospital acquired infection and occur in several different patient groups. The most important patients are on ventilator in intensive care unit where the rate of respiratory infection is 3% per day. And the third one is the wound and skin sepsis. Surgical site infection are also frequent, incidence varying from 0.5 to 15% depending on the type of operation and underlying patient status. Incidence of post-operative infection is much higher in elderly patients above the age of 60. The infection is acquired usually during the operation itself, either exogenously and endogenously from the skin flora or rarely from the blood used in the surgery. And the fourth one is the gastrointestinal infection, which are from the nosocomial infection in children where rotavirus is a chief pathogen. Clostridium difficile is the major cause of nosocomial GI infection. And fourth one is the burns, and fifth one is the bacteremia and septicemia, which is spread from the nosocomial infection. And next one is the diagnosis and control of hospital acquired infection. Diagnosis is by the routine bacteriological methods such as direct smear examination, culture and sensitivity test. Diagnosis of hospital acquired infection: evaluation of symptom and sign of infection, examination of wound and catheter entry site for redness, swelling or in the presence of pus or an abscess. Then the next one is that this required the sample from the possible sources as hospital personnel, inanimate objects like water, air and food. जो एंडोजीनियस और एक्सोजीनियस सोर्सेज हैं उसके हम सैंपल लेंगे और उससे हम हॉस्पिटल एक्वायर्ड इन्फेक्शन क्या है डायग्नोज करेंगे. और अनदर टाइप ऑफ डायग्नोज इंक्लूड द कंप्लीट ब्लड काउंट टू लुक फॉर एन इंक्रीज इन वाइट ब्लड सेल, urine analysis to look for white cell or evidence of blood in the urinary tract, and culture of the infected area including blood, sputum, urine or other body fluid or tissue to find the causative organisms. A complete physical examination is very necessary. Chest x-ray may be done due to pneumonia is suspected to look for the presence of white blood cell and other inflammatory substance in lung tissue. And next one is the control of hospital acquired infection. Under the control of hospital acquired infection, autoclave is very necessary, sterilization is very necessary, and disinfection procedures are very necessary to combat the hospital acquired infection. And the next one is the prevention of hospital acquired infection. Under the prevention, administration of antibiotic therapy to the carrier staff or source patient to destroy the pathogenic agent, proper sterilization and disinfection of the equipments, disinfection the excreta and infected material, regular hand washing. High risk procedures and other possible sources of infection should be identified. Aseptic technique in the performance of procedure should be strictly followed, including use of sterile gowns, gloves, masks and barriers. Sterilization of all reusable equipment such as ventilator, humidifier and any device that come in contact with respiratory tract should be done. Disinfection of excreta is very much important to exit the point of infection. And the next one is the contact between respiratory secretions and healthcare providers should be prevented by using barrier and mask. Preoperative disinfection of the patient's skin and rational antibiotic prophylaxis is very necessary. And the patient with known infection should be isolated from the another person. An infection control practitioner for every 200 beds should be employed to prevent the contamination and infection in the hospital area. The next one is the infection control policy. Every hospital must have an effective hospital acquired infection control committee which should be responsible for control of hospital acquired infection. Hospital acquired and control committee chaired by the medical superintendent, microbiologist, infection control officer, head of clinical department. HAICC must meet at least once a month to update the policy related to prevention and control of hospital acquired infection. They should review the infection control activity of hospital, hospital environment, sterilization and disinfection procedure. Emergence of drug resistance among pathogens, use of different antimicrobial agents against which pathogens show no resistance, and in this policy the medical record officer and chief of nursing services are must included to prevent the hospital acquired infection. The hospital acquired infection team should meet at least once a week to look after surveillance, control of infection and monitoring of hygienic practices. So it should prevent the hospital acquired infection as much as possible. Thank you.